Brianna Lowry is an RT from Vancouver Coastal Health, and I'm going to present a little bit about the work that she's done preparing some resources for RNs and physicians as well that are working in rural and remote areas and may not have RT support. Brianna really wanted to be here to share her story, but she had a conflict. And so she shared her slides with me, and I'm going to do the best I can to share her role and also kind of talk a little bit about what we'll be able to do at Critical Care BC, maybe to help out as well to get some of these resources shared out really broadly. After I'm finished, we also have Fisher Paykel representation here. And so Sarah Drohan is going to share a little bit about the products, the respiratory therapy products that Fisher Paykel has. And there's a lot in BC. I didn't realize how many products they actually have. And Sarah will also talk about some of the resources and like in-person support that she's able to offer at some of these sites. Brianna, she's a regional interprofessional respiratory therapy educator for rural and community sites. And so mostly serves the coastal region, and we'll go through those sites afterwards. Brianna was in an RT role from 2014 for a very long time, worked through a number of different roles, including some Indigenous health training. And then she did a few other things and worked for BC Cancer and helped support UBC Hospital as well. But then came back into direct care practice with the RT group, and now she's moved into a bit of a leadership role for them. And so they did a bit of a needs assessment I think it was about 2022, across the coastal regions to see what kind of respiratory support folks needed. And there were a lot of queries for respiratory support, a lot around ventilator settings and how to do testing and stuff with ventilators. And so they've worked really closely with a lot of the interdisciplinary teams up the coast to be able to provide some resources when RT coverage at the site is either non-existent or less than optimal. And while some of those sites that they originally supported have RT coverage now, there wasn't at the beginning. And so some of the RNs and physicians also needed to be some resources shared with them so it could support their practice. And yeah, so that was a bit of her role. And then she's also, so these are the sites that she serves, and she's worked really closely with the professional practice leads through Vancouver coastal region to be able to provide some resources here. And so, like I mentioned, a lot of these sites when they first started did not have RT coverage, and so their team was working with people that had like suboptimal knowledge about how to protect it and keep these patients safe on ventilator support. And so now some of these sites do have RT support. Their team still goes out in person to a lot of these locations to do some helping them order products and helping them choose like which ones they should order, but kind of trying to keep in mind the regional standardization, I guess, of equipment. So when they first started, they discovered that sites had all kinds of different equipment. There was no real like rhyme or reason to the process for selecting equipment, and might have just been historic preference from the people that were actually ordering it. And so Brianna and her team have done a lot of work to try and streamline the equipment that's available in these sites. And so like even talking about, one hospital called her and said, oh, we're going to start evacs in our ET tubes. And it's like, okay, well, for some larger centers, that's standard practice. But for some smaller ones, that's not really. And so she was able to reach out to them and work collectively with them to make sure that they had all the information that they needed for all of the disciplines that would be working with evac tubes. And the same kind of goes for the rest of the equipment that they offered. They were able to work really collaboratively with an interdisciplinary perspective around the resources and support that they would need, and kind of considered some perspectives of those folks that they were trying to work with. And so together with the professional practice team and all the folks she reached out to for support, Brianna's created some videos, resource guides, and infographics to help support staff working without RT support. What Brianna has said is a lot of these resources, because it was Vancouver Coastal, are a bit Vancouver Coastal specific and include information from their clinical decision support tools. These resources, though, even with that, have been shared very broadly across the province with all of the regional RT educators in each of the health authorities. And so I am attending a meeting next week with the RT practice leads, and so I'll kind of get a better idea of where they are with rolling out those resources or even processing them through professional practice. I know sometimes when resources are used from other health authorities, there's a bit of a lag time to kind of get them through the process, the local approval process to use in some health authorities. And I suspect that might be the case for why these haven't been shared a little bit more broadly. But from a Critical Care BC perspective, we'll try and work with Brianna and her team and the RT educator leads to see if we can get some of these resources more broadly distributed and available for use within other health authorities. Because if we think about health authorities like Northern Health, Interior, and Island, there are a lot of regional and very rural sites that lean on the higher level of care sites for support sometimes. And depending on how busy those higher level of care sites are, they may need to wait a little bit longer for like actual connection with them and virtual connects. And those processes are still being built as well within health authorities. And so at least these resources would give them a place to start and be able to handle patient situations in a safe way. And so for any information about the rollout or the process of working together to do all of this initiative, please reach out to Brianna Lowry from Vancouver Coastal Health, and she will be able to answer many of her questions. And if you have, if I haven't been able to answer some of the things that have come up for you around this, she most certainly will. Brianna also presented at the Critical Care BC Nursing and Allied Health Community of Practice. Oh, I'll stop sharing now. And she was able to share some of the finer details about that work. And so it really has been quite a process for them. So if you are considering this in some other areas, please reach out to Brianna. And that is it for my section of the presentation, but we do have Sarah Johan, who is here from Fisher Paykel. Are you online? I saw you.
See me?
Are you?
There
we go. Yeah,
awesome.
I sure can. Yeah.
Excellent. Thanks for having me, Sybil. Thank you. Great presentation to Kim, Sarah, and Camille. Very meaningful work. That was great. So as Sybil had mentioned, I am from Fisher Paykel Healthcare. So I am the regional sales manager that covers Ontario through to Western Canada. So my colleague and your primary point of contact, Cheryl, I am subbing in for her today. She is excellent. She is a respiratory therapist that is located in Vancouver, BC, and very well known in the RT community. So a lot of the fellow respiratory therapists that you work with at your centers will certainly likely know who Cheryl is and how to connect with her. But what we put together for you guys today is a quick presentation and overview of Fisher & Paykel and some of the products that we support. So Sybil, when I start sharing my screen, I probably will lose my Teams visibility. So just if the presentation goes away or my mic stops working, flag me
Sounds
down.
good.
Can you see the presentation here? Is it up?
Yeah, I can see the presentation.
Is it okay?
Yeah, I think it's okay.
There we go. Okay, excellent. So today we'll go over a quick history of Fisher Paykel Healthcare, touch on OptiFlow nasal high flow therapy. I always like to do a quick poll of hands, but because I can't see anyone at the moment, it's always good to know who's familiar with nasal high flow therapy. It might not necessarily be the connection to Fisher and Paykel Healthcare, but nice to know who's familiar with the therapy. Quickly touch on the use of nasal high flow in ED and ICU. Go over a quick overview of our non-invasive ventilation masks and products available, as well as our invasive ventilation humidification platform. And then touch on a quick review of educational resources that are available to you, in addition to support from Cheryl and education that's provided from Cheryl. So Fisher & Paykel Healthcare, we're often recognized for being associated with excellent high-end appliances, but we are in fact now completely separated entity from this group. Fisher & Paykel Healthcare has been a leading designer and manufacturer of medical products and technology for respiratory care in both an acute care setting as well as a home care setting, treating obstructive sleep apnea. Our global headquarters is located in New Zealand, and improving patient care and outcomes with product innovation has always really been the forefront of what we do. So we're predominantly known for our humidification technology, which has greatly expanded since the creation of our first humidifier prototype, which was way back in 1969. So a long time we've been pioneering humidification technology. What is nasal high flow? Nasal high flow therapy has many names, such as high flow nasal cannula, nasal high flow, OptiFlow, but fundamentally it is the delivery of high flows of humidified air and supplemental oxygen, which is then delivered through a comfortable interface, providing patients in respiratory distress with respiratory support, so helping stabilize those patients. Nasal high flow systems deliver a flow of humidified and warmed gas to body temperature, which is 37 degrees Celsius, and can reach flows of up to 70 liters per minute. And that's on one of our new devices, which I'll touch on. And that's delivered through a comfortable nasal cannula, a comfortable OptiFlow cannula. The oxygen concentration can be adjusted from 21% to 100% according to the clinical need of your patient. Nasal high flow is proven to provide respiratory support through the reduction of CO2, so washing CO2 from your anatomical dead space, as well as the delivery of dynamic positive airway pressure. And this can impact a patient's work of breathing. Nasal high flow is really more effective therapy compared to conventional oxygen therapy, which is the delivery of a cold and dry gas via a low flow nasal cannula, perhaps a simple mask, or a non-rebreather mask. So nasal high flow across the continuum of care. Nasal high flow is utilized throughout a hospital. It's utilized in both the ED and ICU, and as well as is utilized on the general floors. Implementing nasal high flow in the ED as an initial treatment to stabilize patients in respiratory distress can reduce the need for therapy escalation. It allows easy patient communication and potentially that transition of these patients to a lower acuity setting within the hospital. It allows the use of nasal high flow in the ICU that can reduce the need for intubation or potentially reintubation when used for post-extubation support, as well as potentially reduce ICU length of stay and facilitated discharge out of the ICU to a lower acuity setting. And nasal high flow in the general floor areas can continue patient stability outside of the ED and ICU. The image that I have up on the screen here now is a quick snapshot of our nasal high flow systems that are predominantly seen and utilized across BC. So starting on the left-hand side, you have our Airvo 2, which I would say most facilities have access to an Airvo 2. The Airvo 3 is the new version of the Airvo device, and I'll go into a couple more details of what makes it new and exciting. And on the far right-hand side is what we call an OptiFlow Classic setup, which certainly might still be at some of your centers. And this is essentially a blender and humidifier combination, which integrates the room air, oxygen, humidifies it through the humidifier pot, and delivers it out to your patients. Essentially what the Airvo device is integrated to do. In addition to these systems as well, I'm sure a lot of you are aware that nasal high flow capabilities are also available on a good portion of the ventilators that you guys are using as well. Here I have a snapshot of the Airvo 3 and just some kind of quick high-level points of upgrade to this new platform. The main one being the integration of a battery. So we have added battery capability to this platform, allowing for up to a 40-minute transport throughout the hospital. So for patients who are initiated inside the emergency department, for example, can be then stabilized and mobilized throughout the hospital, or from the ICU, mobilized out to the general care or a lower acuity setting. So that capability has been a long time item on the Airvo wish list, which is exciting now to have on this platform. Oxygen inputs were also upgraded on this device. So we still have a low pressure oxygen input where your oxygen is adjusted from the flow meter, which I'm sure you're familiar with, but also now the integration of a high pressure oxygen input, which is really nice for adjusting and managing FiO2 now on the screen of the Airvo 3 device. The screen is a nice simple touch screen interface. So it's very intuitive, very user-friendly. And standardized consumables operate on both the Airvo 2 and Airvo 3. So the same line of consumables and accessories from the humidifier chamber and circuit kits to the interfaces are used on both devices. So there are quite a few hospitals actually, that are integrating the Airvo 3 now into their nasal high flow fleets. I also wanted to quickly touch on nasal high flow interfaces. So what I have up here on the screen now is a quick image, a quick snapshot of our new OptiFlow Duet, which is an asymmetric nasal high flow cannula, and our OptiFlow Plus cannula. And I wanted to dive into just a little bit more detail on the OptiFlow Plus asymmetrical nasal high flow interface, as this is currently under a rollout across BC. So this will be something that will be integrated very imminently over the next, I'd say, 4 to 8 weeks potentially at your hospital from the warehouse. So just to make sure everybody's familiar with it. So the image up on the screen is our asymmetrical nasal high flow cannula, which is uniquely designed to have 2 different sized prongs, as you can see. So the current prong, the OptiFlow Plus prong, is a prong which is compromised and made of 2 of the same size prong. And essentially, what having decades of experience in nasal high flow therapy has allowed us to do is design an interface that can deliver and enhance therapy. So its unique design enhances dead space clearance. So that's the amount of CO2 that is cleared from anatomical dead space, as well as increasing the amount of pressure that can be delivered to patients. And how this is done, if you take a look at the image on the far right-hand side of the screen, is essentially an altering of the flow of the gas through the interface. So as the bulk of the flow comes into the cannula and interface, it will take the path of least resistance traveling through that larger prong, which creates a unidirectional flow of the gas. And in doing so, it's this smooth unidirectional flow that creates an acceleration and a purging effect of CO2 from the anatomical dead space. So on the right-hand side, you can see a little bit of turbulence with a symmetrical nasal high flow interface, where the same amount of flow is coming through each prong and the same amount of flow is being exhaled through each prong. Where now with the asymmetrical design, that unidirectional flow can help increase the amount of CO2 from the anatomical dead space, allowing for more fresh gas to be available to the patient on that next breath to help improve alveolar ventilation. And in terms of increasing pressure that's delivered to these patients, with that increase in cross-sectional occlusion, we are able to deliver more pressure with this interface. So just wanted to highlight some quick kind of key features and a good picture of what that asymmetric design looks like, because it will be coming your way soon. Transitioning over to non-invasive ventilation, in addition to our products for nasal high flow therapy, Fisher Paykel does offer non-invasive ventilation masks. We have 2 that are currently utilized across the province. We have the FMP Vizero, which is a full face bridge-free NIV mask. So as you can see in the image on the left-hand side, this mask is sort of eliminating contact with a very kind of important and key point, a sensitive point on a patient's face, which is the bridge of the nose. So it's eliminating pressure that gets applied to that region, as well as providing patients with an open field of vision. The Vizero under the nose mask really features a design that's been based on comfort, seal, and ease of use for clinicians. On the right-hand side, you have your more classic style full face NIV mask, and this is the FMP Navero. Some key features of the FMP Navero mask are the roll fit technology, which has been built into the bridge area. So you can, I don't know if you can see my my pointer or my cursor here, but the area of the Navero mask that sits on the bridge of the nose essentially acts in an accordion-like movement. Oh, excellent. Thanks, Sybil. Acts in an accordion-like movement to automatically adjust to the shape of the patient's nasal bridge area, alleviating pressure with a very thin silicone and just applying that pressure to other areas of the seal. And again, the FMP Navero mask was designed with comfort, seal, and ease of use in mind. Over to invasive ventilation. So Fisher Paykel supplies the humidifiers that are utilized with the ventilators utilized within BC. And the newest platform has rolled out to a very significant portion of the province, and that's the FMP 950 humidifier. This was a really exciting product for us to come out with, really because it's where we started back in 1969 with our first humidifier prototype, which was actually built in a mason jar. So if you can picture a mason jar next to this image, we've certainly come miles and quite a way in terms of technology. So the FMP 950 enhances the algorithms that are brought to delivering heated humidification to invasively ventilated patients. It's very easy to use and set up, helps reduce condensation and rainout, and essentially support better care and outcomes in the ICU setting. So I'll transition over. Hopefully, if you guys have any questions, I will be happy to answer those on any of the products after the presentation. But just a quick, to wrap up, review of our educational resources. Fisher Paykel has an education hub that is available with a lot of great content in it. There's really nice short video clips on the application of nasal high flow, how to use it, when to use it, application of NIV masks, videos about humidification for invasively ventilated patients, and why that's beneficial. So just any sort of education you might be looking for. A lot of great content available in the hub that you can go and take a look at. And from within the hub is also access to our OptiFlow Connect program. Essentially, our OptiFlow Connect program is a great program for nursing, especially a new nurse or for any type of refresher training for even existing nurses who've been practicing for some time. It's a very engaging and interactive digital tool that is designed to go over the Airvo 2, OptiFlow Junior 2, which might not necessarily apply to everybody, but upon completion of these either short or extended courses, so they could be anywhere from 15 to 45 minutes, there will be a knowledge check, and it really just ensures that you've kind of hit the high points of each different category and program that's offered. So understanding the therapy, mechanisms of action, how to predict success, and also touches on the clinical and scientific literature that supports that application. So if there's any interest in registering for the OptiFlow Connect program, that is certainly something I recommend getting in touch with Cheryl on, because she will be your primary point of contact to get you registered for the platform. But if you are within that education hub, you can create a request to have access, and that will get looped around to us, and we'll be sure to follow up with you as well. So additionally, I want to emphasize what a great support tool Cheryl is. She's fantastic. She has been with Fisher Paykel for almost 20 years now. Wonderful resource to a number of her customers as well as her colleagues. So any questions, Fisher Paykel product related, respiratory related, she would be happy to address for you. And even if it's outside of her scope, connect you with somebody that could certainly help as well. Our corporate website has a lot of great resources on it and can link you with our education hub. The education hub, also you'll find promotion for evidence and action webinars, which are great webinars that are put on by speakers across North America on a variety of therapy areas that are respiratory related. And those come out monthly. And once you've engaged and registered for your first webinar, you'll usually get kind of the informational update on the next webinar if you have interest in registering. But Cheryl will share our next EIA with you guys, our evidence in action. So if there is interest in kind of tuning into what is available from a subject standpoint, you can sign up and register to get those notifications. Great YouTube channel. I always love a good YouTube video, just a how-to. So we have a Fisher Paykel YouTube channel with, again, a lot of the same resources that you'll also find on the Education Hub, some great product swing tags and resources, as well as applications. This is a really apps I find is a great tool for nurses or any clinician really that might not necessarily have super high frequency with utilizing a piece of equipment. So the next couple of slides go through some of our apps that are available to you. And for anybody interested, you can quickly scan the QR code up on the screen, but we'll also share these with you guys afterwards. But from within the device, the simulator essentially will act like the Airvo nasal high flow devices themselves, stimulating the same buttonology, time sequence, sounds, warm-up modes, but give you some extra supplemental advice, resources such as videos, troubleshootings, frequently asked questions, which you can access from within that platform as well. Here is a QR code to the new Airvo 3 simulator app. And one for the Fisher Paykel, the 950 humidifier. So this is also another great resource for any humidifier related frequently asked questions or quick reference videos and resources. Everything is available from within this app. So with that, I'd like to thank everybody and thank Sybil for having us on the call today. I can jot Cheryl's contact information. I can drop that in the chat as well.
Excellent, Sarah. Thank you so much.
Yeah.
Like I think I mentioned at the beginning, I didn't realize you guys were suppliers for so many things, or that you had that many resources available to help support staff. And one of the reasons that I invited you and Cheryl here was because sometimes managers aren't aware of the resources and support provided by vendors that are free, and they have a contract available, and some managers aren't aware. So if any nurses on the call would like to arrange that, maybe check in with your manager and see if that can be arranged. Because Cheryl has shared with us that she travels all over BC and enjoys having some other, I think the Northwest Territories too, right? And the Yukon?
Yes, which is where she got kind of tied up and had the little... which is why I'm here today. Well, I was going to be here regardless, but running the presentation for her. Yes, so she covers the territories in Yukon as well.
Yeah, so that's excellent to know. Yeah, because at some of those areas specifically, like in the north or island or some of the more regional or rural areas within the interior that definitely need support. Sometimes we tend to get folks on these calls sometimes from larger urban centers, and they may not be aware of the practice constraints in some of those smaller sites where RNs are the ones providing the RT care, and they may or may not have education related to that. So any education to help support them in their practice, to help keep patients safe would be better. And as well, some of the physicians working in those areas as well have never or haven't had a lot of experience with ventilation. And so that's another key area that Brianna and her team have worked with to help support in their practice as well. So super thankful to you and Cheryl, Sarah, for coming to share the resources that you have and kind of the supports that you provide for BC. So thanks very much for coming.
Thanks for having us.
Thanks for watching, everyone, and thank you for joining us on the BC chapter of the CACCN YouTube channel. We have a lot of great content from previous events we've had over the past 12 months. I would suggest subscribe and hit the notification button so you can know when the next thing is out. And if you ever want to come to our next event, we're on Facebook and on Instagram. Our links are listed below. And while I'm on the topic, if you're a critical care nurse anywhere in Canada, why don't you join CACCN? We have a ton of resources to help you be the best critical care nurse you can be. Go to caccn.ca and join us.